Okay, so today I'm going to be starting an IV on my patient. First, I would knock on the door, introduce myself, tell them my name's Emily, I'm going to be their nurse today. I would ask them to state their name, date of birth. Then I would explain the procedure that I was giving them an IV, that it was a doctor's order, why he ordered it, answer any questions that they had, and then I would start to get all of my supplies ready. So first thing I'm going to do, this is going to be my patient. She is going to be getting an IV put in today, so I would wash my hands. I would assemble all of my supplies, so I need tape, a Tegaderm, the IV, an alcohol prep pad, the PRN adapter or extension tubing, normal saline flush, a tourniquet, and then I would also need gloves. So I'm going to first just get my tape ready just because it's going to be really hard with the actual gloves on. And get that where it is accessible. Then I'm going to go ahead and get my gloves put on. Once I get my gloves on, I'm going to apply the tourniquet to my patient to find an accessible vein. So I want to apply and make sure that the tourniquet is tightly wrapped. It's kind of really hard with a banana, but make sure when you tie it in, you have a port that you can pull out. It's accessible. So I'm going to palpate for a vein I'm going to use right down here, and then I'm going to clean in a circular motions for about 15 to 20 seconds, and you're going to move outward from the inside. So let that dry. While that's drying, I'm going to get my PRN adapter ready, hook it up to my flush, and I want to take off the cap to double check that it is primed, and if it's primed it will drip out water, or the flush. So since that is primed, I'm just going to set it back down in there, and I'm going to get my IV ready. So the first thing I'm going to do is go ahead and anchor down the vein. I want the bevel side up, and I'm going to insert 15 to 25 degrees in, and I know I'm in the vein when I see blood popping through. Once I see the blood, I'm going to advance a little farther and push down on this where my catheter can be inserted in. Once my catheter is in, I want to press at the top to help with the blood. Throw this into the sharps container and insert the flush. Once that's in there, I'm going to go ahead and flush it in, and if it swivels up, it means that it's infiltrated. If it doesn't, then that's a good sign. I'm going to unhook my flush and hold down. I'm going to take my first piece of tape and just anchor my IV site. I'm going to take the other one and push underneath of this to anchor and make a Y, and just hold and not push. Okay, and then once that is there, I'm going to go ahead and take my derm and place it over top to keep any type of thing out. And once it is, I'll just take this peel around, and it will stick down to the skin, in this case the banana, and keep everything out. I would document, or I would have released this before once I inserted the IV, but then I would document the date, the time, what gauge needle I used, which was a 20 gauge needle, what I flushed with, how the patient tolerated it, and why I was giving it.